Ask Reddit, doctors of Reddit, what is the most unethical thing you have done or you have heard of a fellow doctor doing involving a patient? It's gotta be Robert Courtney. He diluted cancer chemotherapy drugs for years to make profit. Countless deaths, countless needless treatments, countless cancer study data rendered useless. By one man. My best friend's mother, Rula, is from Lebanon. When Rula was a young girl, she got pretty badly injured and went to the hospital. The doctor then proceeded to tell Rula's mother that she had passed away due to the injuries. She did not believe her and soon discovered Rula locked in a closet, waiting to be presumably be sold into slavery. My roommate in dental school was a medical student. There was some big scandal at the hospital he was doing a rotation at because an anesthesiologist left the OR with the nurse anesthetist and left the patient alone. Something went wrong and the patient passed away on the table. Where were the two of them? Getting down in a nearby unused room thinking that nothing could happen in just a few minutes. It was in the news here, but there was a surgeon in Birmingham I think who diathermed, essentially burnt, his initials onto patients' livers. My colleague worked with him and saw him do this. I personally haven't seen much that's too bad. There are a lot of pretty dark jokes in the doctor's office but nothing potentially damaging. A nurse did once offer to give me unprescribed flucloxacillin for a skin infection but I politely refused. I'm a general surgery resident. We had a patient that had been on our service for about a year. Older fellow, very sick. Every now and then, he would go into respiratory distress, get intubated, or BiPAP, for a bit, always would bounce back to his baseline of 8 out of 10 sick. Everyone called him the Rock. But not in a cool, do you smell what the Rock is cooking way? In a boring sick person that sits their way. Well, he had always been a full code. That means that in case of dying, we do everything we can to keep him alive. After a long time of being inpatient, my attending was sick of him and made him a DNR/I, which means let him pass if he starts to struggle. He didn't want this, but they got away with it saying that he did not have capacity, and he was decently with it, but I can see that argument. So talks with the family started and they specifically stated that they wanted full code. My attending didn't agree and decided to call them to confirm. But we think he purposefully called the wrong number many times and eventually decided for himself that he was DNR/I. 2 days later the guy went into RESP distress and died. I came to rounds the next morning to two attendings yelling and screaming about the right thing to do. Maybe I feel that it's better that he passed as well. But his family's wishes were ignored and purposefully evaded. I could never go against someone's wishes. I once knew an OB who didn't like to work after about 5 p.m., so at the end of office hours, if they had someone in labor they would swing by labor and delivery and find a reason to do a C-section on them. Sometimes they blamed the baby's heart rate tracing, justified or not, but the classic one would be that they would check the patient's cervix and lie about how dilated it was so it seemed as if labor wasn't progressing rapidly enough, and say, I just don't think this is going to work, cut her, and be home for dinner. Now in OB we love TLAs, 3-letter acronyms, and one of the real indications for cesarean is CPD, cephalopelvic disproportion, which is where the baby's head is too big for the pelvis. But for this particular doc we always said that they cut patients for CPD, cesarean prior to dinner. Edit, no I didn't report this doc because it's not possible to report someone for a subjective judgment call. As for this doc not being allowed to practice anymore, a hospital can't revoke privileges for being a shitty doc even if they want to. The law is written in such a way that the hospital would easily be sued for restraint of trade. I don't like it either, but unless laws get changed that's what we're stuck with. Well, he had always been a full code. That means that in case of dying, we do everything we can to keep him alive. After a long time of being inpatient my attending was sick of him and made him a DNR/I, which means let him pass if he starts to struggle. He didn't want this, but they got away with it saying that he did not have capacity, and he was decently with it, but I can see that argument. So talks with the family started and they specifically stated that they wanted full code. My attending didn't agree and decided to call them to confirm. But we think he purposefully called the wrong number many times and eventually decided for himself that he was DNR/I. 2 days later the guy went into RESP distress and died. I came to rounds the next morning to two attendings yelling and screaming about the right thing to do. Maybe I feel that it's better that he passed as well. But his family's wishes were ignored and purposefully evaded. I could never go against someone's wishes. This happened a few years ago when I was a third-year med student doing my general surgery clerkship. Right off the bat, I'll say I really couldn't stand the surgeons who ran the rotation. They were egotistical, unprofessional assholes who only cared about how much you kissed up to them. And this went way beyond the usual surgeon stereotype. I had shadowed surgeons in high school and college, always wanted to be one. But this department? Completely dysfunctional on a level I've never seen before or since. I could write a whole book on the insanity that went down there. Anyway, this particular incident started about a month in. By that point, we med students had gotten into the groove. We'd get there around 5:30 a.m., do the morning conference and rounds, spend the day in the OR or clinic, and usually finish around 4 to 6 p.m. if we were lucky. A couple times a week, we had call shifts. Basically we'd head to the ER after hours and work there until about 11 or midnight. So this one night, I show up at the ER like usual. The attending on call greets me and gives me a rundown. Most of the patients are the usual random stuff: abscesses, minor lacerations, nothing crazy. But then he says we just got an interesting one, a woman in her early 70s, brought in by ambulance, well, actually, a second ambulance. Apparently, she went to her GP complaining of dizziness. The GP didn't want her driving like that, so they called an ambulance to take her to the hospital. On the way, that ambulance got into an accident and flipped. So a second ambulance had to come pick her up and bring her in. Now we're not just dealing with dizziness, we also have to check for internal injuries. She gets a CT, and then is placed in the urgent room in the surgical ER. This is the area reserved for the real serious stuff: stabbings, gunshots, major traumas. She's hooked up to all the monitors, but she's awake, alert, and actually in pretty good spirits. So I go over, introduce myself, tell her I'm the med student on duty tonight, and if she needs anything, just let me know. I'll call her Mrs. X for simplicity. Later on, we get the CT results. Radiology says no internal bleeding or injuries. The attending and the resident both review it, and everything seems fine. The night moves along. I'm mostly helping the resident with the usual gross stuff, cleaning up after draining some anorectal abscesses. For some reason those always showed up when I was on call. Every now and then I check in on Mrs. X, she's doing fine. Around 11 p.m., the attending says it's slow and I can head home. I say goodbye to everyone, tell Mrs. X goodnight, and that I'll see her in the morning. Next day, I show up at 5:30 for the usual morning meeting. But as soon as I walk in, something feels off. Everyone's quiet. Tense. Not even whispering. We're all waiting for the department head to show up. He walks in, sits down at the head of the table without a word. This guy, an older German Jewish surgeon in his 60s, was infamous. Super strict, never smiled, no compliments, always angry looking. Like a walking World War II villain stereotype. Some of the residents had Nazi-themed nicknames for him, which, as a Jewish guy myself, I found ironically hilarious, but that's beside the point. Anyway, he sits there in silence for about 30 seconds. Then he just explodes. Pure rage. Red-faced, yelling so fast and furious it takes us a minute to even understand what happened. Turns out, around 1 or 2 a.m., Mrs. X started deteriorating. She was rushed to the ICU, and by the time of the meeting, she was in a coma with almost no chance of recovering. Why? Because that CT everyone thought was normal? It wasn't. Apparently, she had a very obvious lacerated spleen missed by the radiologist, the attending, and the resident. And to make it worse, the resident had written 24-hour observation in her chart. Sounds okay, right? Except in that setting, you have to specify what you want observed: vitals every X minutes, urine output, anything. But there were no instructions, so everyone assumed someone else was on it, and she got ignored. The department head just kept going, calling the resident incompetent, saying she'd be kicked out of the program, telling the attending he should start looking for a new job. It was brutal. Then, to wrap it all up, He asked what they planned to tell Mrs. X's family. Total silence. Fast forward a couple months. I'm done with surgery, now rotating through a family medicine clinic in the suburbs. This elderly man comes in for something simple, like a cough. The doctor I'm working with, let's call him Dr. Mike, says the guy has an interesting story. Turns out, this man is Mr. X, Mrs. X's husband. He tells me how his wife had dizziness, was sent to the hospital by ambulance, and how the first ambulance crashed. Then how the doctors told him she had internal injuries from that crash and died despite their best efforts. He said he was in the ER with her that night, trying to get someone to check on her, and no one came for hours. He was furious. He was suing the ambulance company, thinking it was their fault. And I just remember feeling this wave of anger come back, knowing what really happened, and how much he'd been lied to. So I told him everything. That I was on call that night. That I spoke with his wife. That multiple doctors missed the diagnosis. That the resident wrote a useless chart note. That she was neglected, and the whole department knew it. That they lied to him. Dr. Mike just looked at me, shocked, but almost grateful. He and I had gotten along really well, shared a similar philosophy on medicine and life. He thanked me for being honest. Mr. X too. And they promised to keep my name out of it because yeah, I was still a med student, and I knew this could blow back on me hard. I had seen another student get expelled the year before for speaking out about shady admin stuff. So yeah, I was scared. But I knew I did the right thing. A couple years later, I heard from Dr. Mike. Mr. X sued the doctors and the department. The hospital settled big time once they realized not only was it a clear case of medical error, but also that the doctors had lied to the family to cover it up. That part made the payout significantly larger. Of course, none of that brings Mrs. X back. And honestly, I wish they had taken it to court and gone after their licenses. But Mr. X did what he had to do to move on. And I'm glad I could at least help make sure those assholes paid something for what they did. That's the most unethical thing I've ever seen a doctor do to a patient. The end. Edit, I may have given the incorrect impression that it was the initial missing of the diagnosis, or the chart error that had made me angry. Mistakes are unfortunate and do happen in the profession. I have made mistakes in my career. It was the handling of the mistake after the fact by outright lying to the patient's family that I found upsetting. That's it for today's video. If you enjoyed it, make sure to leave a like, subscribe, and comment down below what you thought about these stories. What would you do in their situation? Here are some other videos I highly recommend, and don't forget you'll find a wide variety of them on my channel. See you next time.